My name is Dr. Doug Jackson, and I am a family medicine primary care physician in Santa Barbara. I've been in practice for a little over 40 years. I'm the current medical director at my group, supervising physicians and advanced practice clinicians. Well, you should take the COVID-19 vaccine because it's a very effective vaccine, a very safe vaccine against a very serious illness. Well, these vaccines were developed in record time. They're very safe vaccines. The prevalence of serious side effects is virtually zero. Some of the safest vaccines we've ever had are out there at this point. And in fact, some of the most effective vaccines are out there right now. The vaccine allocation, i.e. how many vaccines do we get, is based on county population. Santa Barbara County has a population of just short of 500,000. So we're getting our share of vaccine. The problem is we seem to have a much higher number of older people who initially, in the initial stages, needed to be vaccinated. And that's one reason for the shortage. If you are eligible now, there are multiple websites out there available for you to sign up. If you're not somebody who can use the internet comfortably, find somebody to help you. You might check out My Turn, Cottage Health, Sansom Clinic if you're a Sansom patient, and sign up and get that vaccine. So who's getting vaccinated right now, and when will you be able to be vaccinated? Currently, vaccination is cleared for individuals down to age 65 and higher. It's been opened up as of March the 1st to agricultural workers, individuals in education, and beginning around the 15th of March, it's going to be opened up to individuals between the ages of 16 and 64 who are at very high risk for getting COVID-19. Yesterday, President Biden spoke and indicated that he was going to insist that the states open up vaccination to all adults by May the 1st. Now, the infrastructure to give the vaccine at various locations around the county is in place. Individuals between 16 and 64, all individuals will be eligible to get the vaccines. The problem, which has been a problem throughout the entire process, has been vaccine adequacy in terms of supply. But at least everyone will be available, or be eligible rather, to get the vaccine. And it's a matter of how quickly the drug companies can crank out the vaccine and get it distributed. These vaccines prevent people from getting and spreading COVID-19 by stimulating the body's immune system to make antibodies to destroy the virus. In terms of effectiveness of the vaccine and duration of protection, it would appear that the vaccines range between 75 and 95% in terms of prevention of even getting COVID-19. I would say the prevention of serious disease, hospitalization, and death approaches 95 to 100%. In terms of duration of coverage, nobody knows. These are new vaccines. It's really hard to say. In terms of the issue of continuing to wash your hands, socially distance, wear a mask, it's really unclear how long that's having to go on. I think people talk about herd immunity. Nobody knows exactly what that means, what that number is. Dr. Fauci has kind of progressively increased his number over the last year or so. But until we achieve a really low level of infection in the community, everyone's going to have to continue to mask, distance, and be careful. In terms of natural immunity after a COVID-19 infection, it's unclear how long that lasts, and it's also unclear the degree to which the immunity is protective. There have been documented cases of people getting COVID-19 twice. I've read a couple of reports that immunity conferred by vaccination is actually stronger than the immunity conferred by native infection or actual infection, which is surprising. Well, so far, the recommendation is that yes, you ought to get vaccinated even if you've had COVID-19 and recovered. We're not sure exactly how effective and how long lasting the antibody response is and the innate, what's called the humoral immune response is after COVID-19 infection. The general recommendation right now is to wait about 90 days after resolution of your infection to get vaccinated. It's my professional opinion that, with very few exceptions, everyone out there ought to get vaccinated. People who probably should not get vaccinated are people who had very severe anaphylaxis or anaphylactoid reactions from previous vaccines or from other causes. But even those people can get vaccinated in controlled situations with medical treatment available. So far, to my knowledge, nobody has died from COVID-19 vaccination. Okay, so how many shots do you have to have? The Pfizer vaccine is 2 shots spread 3 weeks apart. The Moderna is 2 shots spread 4 weeks apart. The Johnson & Johnson vaccine is 1 single injection. Can you take just one of the 2 doses? Well, you can. I wouldn't recommend it. The studies have been done on 2 doses, and so I can't give you any hard and fast reassurance that the 1 dose of the Pfizer Moderna are going to be protective. Should you take your 2nd dose at the first site that you went to? The answer is yes. Occasionally there may be supply problems with the 2nd shot, and people may have to scramble to get their 2nd shot at another location if they can. So do you have to stay with the same shot the 2nd time? And the answer is yes. These shots work by different mechanisms, provide different immune responses, and so the definite recommendation is that you stay with the same shot that you had the first time. So which vaccine should you get? I'd recommend you take the first vaccine that you can get and get that jab in your arm as quickly as possible. There's no evidence really at this point that one vaccine is better than the other. So how much time has to elapse between getting the vaccine and protection is not well established. The best guess is probably within 2 or 3 weeks after your 2nd vaccine for Pfizer and Moderna. And actually the J&J seems to have a little bit of an advantage by having good protection 2 weeks after the single injection. For people who've had the COVID-19 infection, they should be vaccinated. The general recommendation right now is to wait about 3 months to get the vaccination started. So what about vaccine side effects? Well, these vaccines do cause side effects. Fortunately, they appear to be fairly minor in nature. Pain at the site of the injection, a sore shoulder, low-grade fever, feeling poorly for a couple of days, fatigue. These side effects are minor, not long-lasting, and pale into insignificance compared to actually getting COVID-19 and having a moderate to severe or a severe case. This is a really nasty illness that puts people in the hospital for a significant length of time, puts them on ventilators, and there's also an appreciable risk of dying. If you want to talk about the potential interaction with vaccines and medications, at this time there appear to be no difficulties with that, with any medication patients are taking. It's possible for people who are immunosuppressed, for example from cancer chemotherapy, that they could have a reduced immune response, but that doesn't mean they shouldn't take the vaccine. What about reporting a bad reaction to the vaccine? Well, first of all, the risk of a bad reaction and the prevalence of bad reactions is very, very low. But on the other hand, if you do have a bad reaction to the vaccine, I would recommend that you contact your physician, who in turn can report the reaction and the type of reaction to the FDA so that they have accurate information so we can intelligently advise people about the vaccines. Can you get COVID-19 from the vaccine? The answer is a resounding no. You can't get COVID-19 from the vaccine. These vaccines don't have any live virus in them. Therefore, that disease can't be transmitted by any of the vaccines. Can children get the vaccine? Should they have the vaccine? Well, studies have not been done on children younger than the age of 16 at this point, and so the vaccine is not approved for children yet. Fortunately, children tend to have very mild cases of COVID-19, and the fatality rate from the infection is vanishingly low. Can pregnant women get the vaccine, or women attempting to conceive get the vaccine? Although the studies did not include pregnant women or women who were attempting to get pregnant, at this point, the vaccine can be given to pregnant women and women attempting to get pregnant. And the reason it can be and should be, in my view, is that the risk of serious disease seems to be higher in pregnant women, and the risk of damage to the fetus is correspondingly high. What about other methods of preventing COVID-19, whether it be supplements, vitamins, drugs like hydroxychloroquine? There's no evidence at this point that supplements, drug therapies of different kinds can prevent COVID-19 infection, and I wouldn't recommend those. I'd recommend trusted sources to get your information, whether it be your personal physician, trusted sources on the internet, the CDC website, the Johns Hopkins Medicine website are excellent sources. The Santa Barbara County Public Health Department website for local residents in Santa Barbara County can give you good supplemental information. So we have someone who is vaccine hesitant or doesn't want the vaccine, a family member or friend. What do we do? How do we talk to people like that? And the answer is you don't hit them over the head with it. You have to really emphasize the safety of the vaccine, the very effective nature of the vaccine. And the other issue is that we're not getting back to normal in this country until we achieve herd immunity. And that's not going to happen until we have a substantial portion of the population that's been immunized. I think you just have to continue to talk to people and not preach to them. I think you have to emphasize, as I've said all throughout this talk, the safety is outstanding and the effectiveness is as well. We're not going to get away from wearing masks and socially distancing. We'd all like to do that, and that's not going to happen until people really do their part in terms of making this pandemic go away.